Hello, I'm Dr. Emily Carter, and today I'm going to share something with you that may seem contradictory, perhaps even shocking. During my 30-plus years working with cardiac patients, especially those over 60, I've observed a pattern that many of my heart surgeon colleagues also notice, but rarely discuss openly. It's not that walking is bad. That's not it at all. The problem is far more subtle, far more specific, and it has to do with what's happening inside your body at this stage of life that makes traditional walking, the kind we've always been told is the best form of exercise, potentially inadequate and even risky for your heart. You probably grew up hearing that walking is the perfect exercise. It's free, it's natural, it doesn't require special equipment, and everyone can do it. And for decades, that was the standard recommendation. Walk 30 minutes a day and you'll be healthy. But here's what we've discovered in operating rooms, in specialized cardiology practices, in cardiac intensive care units. When we analyze patients who arrive with cardiac events after age 60, a significant percentage of them were following exactly that recommendation. They walked regularly. They thought they were doing everything right, and still, their hearts failed. This doesn't mean these people did anything wrong, quite the opposite. They were trying to take care of their health. But what heart surgeons see, and what I need you to understand today, is that after age 60, especially after 75, your cardiovascular system undergoes profound changes that make certain types of exercise less effective and potentially dangerous. Traditional walking, the kind you see people doing in the park, on the treadmill, around the block, may not be providing the benefits you imagine. Worse yet, it may be creating silent stress on your heart that accumulates over time, without you experiencing any symptoms until it's too late. I know this may be confusing. You might be thinking, but my doctor told me to walk, and they probably did, because that's been the standard recommendation for generations. But medicine advances, our understanding evolves, and what we're discovering now is that age isn't just a number. It represents real biological changes, changes in heart structure, in arterial elasticity, in the capacity to respond to physical effort. And these changes require us to completely rethink our approach to cardiovascular exercise. Topic 2. What happens in the operating room? Let me take you inside the operating room for a moment. When a cardiac surgeon opens the chest of a 65, 70, 80-year-old patient, what we see isn't simply an older heart. We see specific transformations that directly affect how that heart responds to exercise. The coronary arteries, those that feed the heart muscle with oxygenated blood, frequently show atherosclerotic plaques. These plaques don't appear overnight. They develop over decades, gradually narrowing the blood vessels. But here's the crucial detail. During prolonged walking, especially at a constant, moderate pace, the heart needs to increase its work in a sustained manner, pumping more blood through these already narrowed arteries. For a young, healthy heart, this presents no great challenge. The arteries are flexible, dilate easily, blood flow increases without difficulty. But after age 60, especially if you have any degree of arterial stiffness, which is extremely common even in people without diagnosed heart disease, this sustained demand can create what we call silent ischemia. The heart muscle doesn't receive enough oxygen, but you don't feel chest pain. You don't feel anything. Your body doesn't send the classic warning signals, and you keep walking day after day, creating micro-injuries in the cardiac tissue that accumulate invisibly. Another aspect we see repeatedly are changes in the structure of the left ventricle, the heart's main chamber that pumps blood throughout the body. With age, the ventricular walls tend to thicken and become less elastic. This is called ventricular hypertrophy, and it can happen even without diagnosed high blood pressure. When you walk, especially long walks on uneven terrain or in hot weather, the heart needs to work much harder to maintain adequate blood flow. For a stiffened ventricle, this means disproportionate effort, increased internal pressure, greater oxygen consumption by the heart muscle itself. And again, you may feel nothing wrong until an acute event occurs. Heart surgeons also frequently observe what happens to the heart's electrical conduction system. The specialized cells that generate and transmit the electrical impulses that make the heart beat in a coordinated fashion naturally degenerate with age. This makes the heart more susceptible to arrhythmias, irregular heartbeats that can be triggered by physical stress. Prolonged walking, especially if you speed up or encounter hills, can trigger these arrhythmias. Some are harmless, Others can be fatal. And the problem is, you have no way of knowing which type you'll experience until it happens. There's also the issue of cardiac reserve, which is your heart's capacity to increase its output when needed. Think of it as a safety margin. A young heart has an enormous reserve. It can quadruple its output if necessary. But with age, this reserve progressively diminishes. At 75, many people have only 40 or 50% of the cardiac reserve they had at 40. This means that any extra demand, like a longer or faster-paced walk, can push the heart close to its maximum limit, leaving little margin for emergencies or unexpected situations. Topic 3. Why traditional walking becomes problematic. Now you might be wondering, but Dr. Carter, if walking is so problematic, why is it still so widely recommended? That's an excellent question, and the answer has several layers. First, medical guidelines are based on large population studies that take years to conduct and even more years to influence official recommendations. The science on exercise and cardiovascular aging has advanced significantly in the last 10 years, but many physicians still follow protocols established 20 or 30 years ago. Second, walking is still better than complete sedentary behavior. That's an important point. I'm not saying you should stop moving, far from it. But the type, intensity, and duration of movement need to be reconsidered. The specific problem with traditional walking after age 60 relates to its nature. When you walk for 20, 30, 40 minutes at a constant pace, your heart works in a zone of moderate, sustained effort. For an aging heart, this constant demand can be more stressful than brief periods of more intense effort followed by adequate rest. It seems counterintuitive, I know. We've always been told that moderate effort is the safest, but what we're learning is that variability in effort, the alternation between activity and rest, may be more beneficial and less stressful for a cardiovascular system with limited reserve. Furthermore, traditional walking doesn't address one of the greatest threats to your health and independence after 60, sarcopenia, which is the progressive loss of muscle mass and strength. You can walk every day and still lose significant muscle each year. And here's the connection to the heart that many people don't realize. Strong muscles help sustain cardiovascular function. When you have strong leg muscles, they function as a secondary pump, helping to push blood back to the heart. This reduces cardiac workload. But constant pace walking doesn't build muscle strength. It maintains at best what you already have, and even that diminishes over time. Another critical aspect we observe is the impact on joints. When you walk for prolonged periods, especially if you have any degree of osteoarthritis, which is extremely common after 60, each step generates microtrauma to the cartilage in the knee, hip, and ankle. This causes chronic low-grade inflammation. And here's the connection to the heart. Chronic systemic inflammation is one of the biggest risk factors for cardiovascular disease progression. It accelerates plaque formation in arteries, increases vascular stiffness, promotes instability in existing plaques. So you may be walking to improve your heart, but you're actually creating an inflammatory environment that harms your cardiovascular health. There's also the fall risk factor that needs to be considered. When you're tired from a prolonged walk, your coordination decreases, your reaction time slows, your attention wanders. This is when trips happen. And a fall after age 75 can be devastating, not just because of the immediate physical trauma, but because the recovery period, the forced immobility, the system stress, all of this can precipitate a cardiac event. Many patients I operate on didn't have a primary cardiac problem. They had a fall, broke a bone, became immobilized, developed complications, and then the heart failed. Topic 4. The invisible changes you need to understand. Let's talk about what's happening inside your body right now, changes you can't see or feel, but that are profoundly affecting how you should exercise. After age 60, and especially after 70, your body enters a state we call chronic low-grade inflammation, or inflammaging. This means your immune system is constantly activated at a low level, producing inflammatory molecules that circulate through the body. These molecules directly affect your blood vessels, making them stiffer and less responsive. When you exercise, especially in sustained effort like prolonged walking, you temporarily amplify this inflammatory response. For an already compromised cardiovascular system, this can be the trigger for an acute event. Your energy metabolism has also changed profoundly. Mitochondria, the tiny power plants inside each cell, including heart muscle cells, become less efficient with age. They produce less energy and generate more free radicals in the process. During prolonged exercise, energy demand increases, but production capacity doesn't keep up. This means your heart is working harder, but with less available energy, a dangerous combination that can lead to cellular dysfunction and damage to cardiac tissue. Insulin sensitivity, which is your cell's ability to respond to the hormone insulin and absorb glucose from the blood, also naturally decreases with age. This means that even if you don't have diagnosed diabetes, your body may be struggling to use glucose efficiently during exercise. The heart muscle, which needs a constant energy supply, can suffer when glucose doesn't enter cells properly. Prolonged walking requires sustained glucose utilization, and if your body can't deliver that energy efficiently, the heart suffers the consequences. Your autonomic nervous system, which controls involuntary functions like heartbeat and blood pressure, also becomes less balanced with age. The sympathetic branch, responsible for the fight or flight response, tends to dominate over the parasympathetic branch, which promotes relaxation and recovery. This means that when you exercise, your body may have difficulty returning to an adequate resting state afterward. Prolonged walking keeps the sympathetic system activated for too long, and inadequate recovery accumulates cardiovascular stress over days and weeks. Kidney function also progressively declines after age 60, even in people without diagnosed kidney disease. The kidneys play a crucial role in regulating blood pressure and fluid balance. During exercise, especially in hot weather, you lose fluids through perspiration. If your kidneys can't compensate adequately, you can develop subtle dehydration that increases blood viscosity, making cardiac work more difficult. This is particularly problematic during long walks when you may not realize how much fluid you're losing. Your endocrine system, including the production of hormones like cortisol and sex hormones, has also undergone significant changes. Lower levels of estrogen in women and testosterone in men affect cardiovascular health in multiple ways. These hormones have protective effects on blood vessels, help maintain muscle mass, influence fat metabolism. When their levels drop, cardiovascular vulnerability increases, and exercises that were once safe can become excessively stressful for the system. Topic 5. What really works for your heart? Now. So if traditional walking isn't ideal, what should you be doing? That's the most important question, and the answer may surprise you. What we see working best for cardiac patients over 60, what truly protects the heart and keeps you strong, independent, and safe, is a combination of focused resistance exercises, balance movements, and short periods of variable cardiovascular activity, interspersed with adequate recovery. Let me explain each component and why it's crucial. Resistance exercises, what we traditionally call strength training, are absolutely fundamental. When you work your muscles against resistance, whether using light weights, elastic bands, or even your own body weight, you're signaling to the body that it needs to maintain and build muscle. This directly combats the sarcopenia I mentioned earlier, but the cardiovascular benefit is what really matters here. Strong muscles improve insulin sensitivity, reduce systemic inflammation, increase basal metabolic rate, and as I said before, help with blood circulation. Recent studies show that people over 70 who do resistance training 2 or 3 times a week have significantly lower risk of cardiac events compared to those who only walk. Balance training is equally crucial. Simple exercises that challenge your balance, like standing on one foot, walking in a straight line, placing one foot directly in front of the other, or adapted Tai Chi movements, not only drastically reduce your fall risk, but also improve communication between your brain and muscles, what we call neuromuscular control. This has direct cardiovascular benefits because it improves movement efficiency, reduces unnecessary energy expenditure, and allows you to move with more confidence, reducing psychological stress that also affects the heart. For the cardiovascular component, instead of long, constant walks, what I recommend are short sessions of variable movement. Imagine walking for 5 minutes at a comfortable pace, then increasing intensity for 30 seconds, not running, just picking up the pace, then returning to normal pace for 2 minutes, then accelerating again. This variability teaches your heart to adapt to different demands without keeping it in constant stress. The total duration might be only 10 or 15 minutes, but the benefit to cardiovascular function is superior to a 30-minute constant pace walk, with much less risk. Adequate recovery is perhaps the most neglected aspect of exercise after age 60. Your body needs time to repair, adapt, and strengthen. This means you shouldn't exercise intensely every day. 2 or 3 days of resistance exercises, 2 or 3 days of short variable cardiovascular work, and interspersed days of light activities like gentle stretching or joint mobility work. This pattern allows your cardiovascular system to adapt without being overwhelmed. Conscious breathing during and after exercise is also fundamental. Many people hold their breath or breathe shallowly during effort, which increases blood pressure and cardiac work. Learning to breathe deeply and rhythmically, coordinating breathing with movement, can significantly reduce cardiovascular stress. This is something heart surgeons frequently teach to patients in rehabilitation, but it should be practiced by everyone. Context also matters enormously. Exercising in controlled environments, where the temperature is comfortable, the terrain is flat and safe, and you have access to water and can stop when needed, is very different from walking on uneven sidewalks under intense sun. The environment affects your fall risk, your hydration, the thermal load on the cardiovascular system. Pay attention to these factors. Topic 6. Your action plan for a stronger, safer heart. Now that you understand why some heart surgeons question traditional walking after 60 and know the more effective and safer alternatives, let's create a practical path for you to follow. First, and this is fundamental, talk to your doctor about what we've discussed today. Show that you're informed, that you understand the changes in your body, and that you want to adapt your exercise program according to the latest science. Some doctors may still recommend traditional walking, and you need to understand their reasoning, but you also need to express your concerns and preferences. If you currently walk regularly, don't stop abruptly. Sudden changes can also be stressful for the system. Instead, start gradually reducing the duration of your walks and introducing variability in intensity. Transform that 30-minute walk into 2 15-minute sessions with interspersed acceleration periods. Observe how you feel. Pay attention to signs of excessive fatigue, shortness of breath disproportionate to effort, dizziness, or palpitations. These are signs that your heart is being overloaded. Start incorporating resistance exercises, even if you've never done them before. You don't need expensive equipment or a gym membership. Sitting down and standing up from a chair repeatedly is an excellent resistance exercise that works the leg muscles, improves balance, and can be done in the safety of your home. Start with 5 repetitions. Rest, do 5 more. Gradually increase as you gain confidence. This simple exercise, done 2 or 3 times a week, can transform your functional strength and protect your heart more than hours of walking. Practice balance daily. While brushing your teeth, try standing on one foot for 20 or 30 seconds. Hold onto the counter if necessary, but gradually challenge yourself to release the support. This 2-minute daily exercise can drastically reduce your fall risk, and as we discussed, preventing falls is fundamental to protecting your heart. A life without falls is a life with less cardiovascular stress. Monitor your recovery. You should feel energized and well after exercise, not exhausted. If you consistently feel very tired after exercising, or if it takes more than a few hours to feel recovered, this is a sign that the exercise is excessive for your current system. Adjust the intensity or duration. Remember, more isn't always better, especially when we're talking about an aging heart with limited reserve. Stay hydrated before, during, and after any physical activity. Dehydration dramatically increases cardiac work. Drink water regularly throughout the day, not just when you feel thirsty. If you take diuretics for high blood pressure or other conditions, work with your doctor to find the balance between controlling pressure and maintaining adequate hydration. Pay attention to warning signs: chest pain, chest pressure, disproportionate shortness of breath, dizziness, persistent palpitations, extreme fatigue, nausea during or after exercise are all signs that something may be wrong. Don't ignore these symptoms. Seek medical evaluation immediately. Early detection of cardiac problems can make all the difference between successful treatment and a devastating event. Consider working with a physical therapist or exercise professional specialized in the elderly population. They can create a personalized program based on your specific capabilities, limitations, and goals. The investment in proper professional guidance can literally save your life by ensuring you exercise safely and effectively. Always remember that the goal isn't just to live more years, but to live those years with quality, independence, and dignity. Your heart has worked tirelessly for you throughout your entire life. Now it's time to work with it, not against it, respecting its natural limitations and providing the type of activity that truly strengthens and protects it. Traditional walking may have been the right advice in the past, but now you have the knowledge to make smarter choices based on more recent science and deeper understanding of cardiovascular aging. Use this knowledge. Your heart will thank you, and you'll enjoy healthier, stronger, and safer years ahead. Take care of yourself, and remember, you're in control of your health. Make informed choices. Your future depends on it.